Dr. Miriam Rittmeyer. I'm the Executive Director of Community Health Mission. Community Health Mission is a non-profit medical organization that was founded in 2001 under the name of Community Healthcare Center. In 2006, our organization merged with Savannah Health Mission. That was the first volunteer clinic in Savannah, and they started in 1996. And the purpose of the clinic really is to fill the gaps in the healthcare system for the uninsured. At this moment, we are very grateful that we have 58 physicians that volunteer their time, and therefore we are able to provide care on 20 different specialty care like GYN, cardiology, ophthalmology, family medicine, family practice, internal medicine. Most of our patients, that they come, they are working 1 or 2 jobs. They have a decent income, but they cannot afford insurance. We receive a lot of in-kind services donated to our patients, and grants and community donations. And currently, we have one organization that works very closely with women's issues called Womenade. And they have adopted our program, One Woman at a Time. That is a strong program that we have here for our patients. With this program, patients they get a complete physical exam for their chronic diseases, treatment for chronic diseases. They get an appointment with a GYN physician, and we provide a pap smear and a mammogram. Therefore, this program, it links very well with the mission of Womenade.
Hi, my name is Mary Ann Springthorpe, and I'm treasurer of an organization called Womenade. Womenade is an organization that was formed here in Savannah in the spring of 2006. The sole goal of the organization is to raise funds to help women who are in need. The concept is to gather women together in a social environment and at the same time make donations to the chosen charity, and we choose a different charity each year. And each of these charities will, of course, be those that are dedicated to the needs of women in crisis. One of our board members saw an article in a Washington, D.C. paper about a Womenade event. And she was reading about this in the spring of 2006, got very excited about it, and started talking to other Savannah area women. So we decided that this was something that was needed in our area, and we wanted to do something about it. Almost any social event can be a Womenade event. We have tennis parties, lunch brunches, bridge parties, luncheons, potluck dinners, book club. Almost any social event can be turned into a Womenade event. We want to harness the energy, the creativity, and all the resources that local women have so that we can turn that around and use it to help women in crisis in our area.
My name is Joan Kelly, and I'm a bus driver for First Student. I've been driving bus now going on 10 years. You're kind of your own boss without anyone really looking over your shoulders, and you get a chance to make an impression on kids that need it the most. Well, my husband had dropped our major medical insurance about 2 years ago, and being that he's already on Medicaid at the age of 78, and I'm not nowhere near there yet, I had to kind of fend for myself. So one of my church members told me about the clinic, and that's why I'm here. Oh God, they were warm, understanding. I've had a triple bypass and I was on medication, and I'm also a diabetic. And I really needed to get my hands on the pills and everything that I needed for myself. And without the clinic, I wouldn't have had that. Okay, I've been in the smoking program since I've got here. We started the diabetic program in August. I've learned that I'm not eating right and I need to exercise more. And considering my age, it's going to be a little bit longer for me to flip over my new leaf so I can get myself back to par. But I'm still working on it hard. I've already sent about 4 people over here because they didn't have insurance. And I tell them all the time that you don't have to worry about it. If you come here, they'll take care of you. I'm in the diabetic program, which is also exercising with seniors, swimming at the Y. And I have lost some weight since I've been in the diabetic program, and I plan to lose more. I'm gonna give Tina Turner a run for her money. I lucked out. I think I came at the right time and at the wrong time, because I'm only gonna be here a year, and I'll be 65 and I'll have to let go, so then I'm gonna probably come back as a volunteer. I gotta not get misty when I think about how wonderful they are. They let you know right away that you don't have anything to worry about, that they're here for you. And that took a lot off me.